Let's go through what happens to your cervix during labour. First, there is softening, also known as ripening of the cervix, which refers to the process by which your cervix becomes softer, thinner, and more elastic in preparation for birth. This physiological change is essential for the progression of your labour and the eventual birth of your baby. So let's go through a more detailed explanation of your cervix softening. So in the normal cervical state, your cervix is usually firm and closed, and it serves as a barrier between your uterus and the outside environment. During pregnancy, it acts as a protective barrier to prevent infections and to support your growing baby. When your body starts preparation for labour, hormonal changes in your body, particularly the release of the hormones prostaglandins, estrogen and oxytocin, this starts the process of your cervix ripening. Estrogen levels rise as your labour approaches, contributing to the softening and dilation of your cervix. Estrogen also promotes increased blood flow to your cervix, which helps to soften and prepare it for labour. As your cervix ripens, it undergoes noticeable changes in texture. So at first your cervix may feel firm like the tip of your nose, but as ripening progresses, it becomes softer and more pliable. Your cervix also begins to efface or thin out as it softens. During labour, contractions help to further soften and dilate your cervix, allowing your baby to descend through your birth canal. In some cases, medical interventions may be used to artificially ripen your cervix if it is not softening on its own. This may involve the use of prostaglandin medications to help soften and prepare your cervix for induction of labour. Let's now go through effacement and dilation, which are two key processes that occur in your cervix during labour. So effacement refers to the thinning and shortening of your cervix as it prepares for birth. So normally your cervix is thick and long, and it forms a barrier between your uterus and the birth canal or vagina. Effacement occurs as the muscular walls of your cervix contract and stretch, causing it to gradually thin out. Dilation refers to the opening of your cervix. Your cervix starts off closed with a small opening. As your labour progresses, the muscular walls of your cervix relax and stretch, allowing it to dilate and widen. Dilation is measured in centimetres, with 0 centimetres indicating a closed cervix and 10 centimetres indicating full dilation. At 10 centimetres, your cervix is fully dilated and your baby's head can pass through your cervix and into the birth canal. Dilation typically occurs in conjunction with effacement as your cervix thins as well as opens to accommodate your baby's descent. Effacement and dilation are both important components of the labour process, allowing your cervix to prepare for birth and help your baby descend through the birth canal. Your healthcare providers will monitor effacement and dilation during labour to assess your progress and determine the appropriate time for interventions, such as pain management or augmentation of labour where your labour is artificially sped up.